Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Okay. Oh, let me see. How can I get out of here? Wonderful. Well, we don't need to, we can pass this by. There's nothing we can do about this one. Let's go to the next one. This is something that is now becoming very discussing everywhere. Everybody's talking about all over the globe. What do you do with Omicron? And anybody else turned positive since last week?
I tested positive Tuesday last week.
Right, and so did Buchanan. Anybody else? Okay.
Daughter tested positive that lives with me, but I didn't.
Oh, that's interesting.
It is.
Yeah. Well, this has been an interesting article that I thought was very helpful. That Omicron is mild for the vaccinated, but may not be mild for the unvaccinated. And they talk about how the odds of going to the hospital and dying from coronavirus is 10 times more likely if you are not vaccinated. And I think most of the people that have been vaccinated come down with it have had mild situations, but there have been those who have required hospitalization and some have died. So it's something to take very seriously. It also talks about the fact that don't be surprised if you're fully vaccinated, meaning you have a booster and you still test positive, as two of you have already experienced. And this is something that may mean that we need to have more tests. And I think Biden buys some 500 million tests for the people to test themselves. And so that should be helpful in some ways. Interesting data demonstrates that although the surge is on with Omicron, the hospitalization rate is not what it was before. And I think that's because many of our population is already vaccinated. And this is something that has been a cause for discussion. And there's another article that talks about this that suggests that unlayered masks are not going to protect you from Omicron. So suggesting that you need to wear N95 mask if you're going to be indoors. But that cloth masks are not as useful for Omicron as they were for the other variants of the coronavirus. Any comments about any of those things? Because I think this is a issue. The other issue is, what do you do if you turn positive? How did you guys who turned positive, how'd you handle it?
Well, I had a rapid test on Tuesday, but I had already taken a PCR test, but the results didn't come back till Wednesday on that. But when I got back home, in fact, I was at the bowling alley, and I got a call that a location was available for me to get a test about a mile from the bowling alley. I finished bowling and went over there. But Tuesday evening, I took a rapid test and that came back positive. So I was on quarantine from that point on. I stayed in my office, the bathroom, and the bedroom. That was it. I have a separate way to handle that. So it worked out. Quarantine for a week.
That's nice when you have, that's an ideal situation. Or if you live alone, that makes it easy. But some people don't have that luxury, and especially if you only have one bathroom. So, but it's good that you could do that. Well, this is interesting that COVID can affect fertility, but it doesn't really. We don't need to dwell on this one because in our group we're not planning to get pregnant. But this is an interesting article which shows how when the kids come up with it, just about everybody gets infected because they always sneeze in their parents' faces. Uh, uh, and I don't know how many of you have grandkids that come over, but especially those under 5 who can't wear masks. And this is kind of a challenge. And as a consequence, yeah, so any of you had that challenge with the grandkids coming over for Christmas? Coughing in your face? Well, that's good.
Yeah, I talked to Kevin. His daughter got it, and his son got it, I think, and they were all together for Thanksgiving.
Yeah.
My the singer with my band has 3 kids. The oldest one got it. He was in the military, and she was at the. I went yesterday for a rapid test, and she was there with 2 of her sons, younger sons. I think one was 8 and one was 5. And the one was 5 was positive. Yeah. So it definitely, if you're in the house with anybody who has it, you're going to get it. I mean, it's almost.
Yeah, it's the most contagious of all of the variants. But you know, it's tough for the family. Tough for the family, especially if you got little kids. How many of you invited the grandkids over for Thanksgiving or Christmas?
We did.
We did.
How did it work out?
It was fine. I had my kids over yesterday, our so-called annual Christmas gathering, much smaller, just a few people, but it turned out well. Everybody's vaccinated, revaccinated. But that's the scary thing. I'm getting negative feedback from some family members. What's the point? You're going to get COVID anyway. You try to tell them what little I've learned from you, Dr. Callender. You may not die. You may not be hospitalized. You still have to continue on. If you haven't been boosted, get boosted. Be safe, wash your hands, distancing. A lot of people are getting frustrated.
Well, the data is pretty clear that the likelihood of being hospitalized and dying from it are drastically reduced if you've been vaccinated. The data is pretty clear on that matter in terms of why. That's the purpose of the booster and the booster shot is to not only to prevent it from happening, but also should you get it reinfected,
Yeah.
you won't need to go to the hospital or die. And so the likelihood of you having that happen is why we have a vaccination and a booster shot in the first place. Trying to convince people of that is more than a notion, though. But
Dr. Callender, um, it makes me be more observant of people I'm around, like when the grandchildren come over or when anybody visits.
Right.
Uh, we said we were going to take their temperature at the door, but we didn't do it. But the observation is to see if anybody's sneezing, anybody's coughing, anybody looks like they're not feeling well or not eating or something like, that's unusual. We're just really observant.
Mhm.
Well, that's all well and good, but I caught COVID and I was observant, and all the people around me seemed perfectly fine, but I caught it anyway. Just really transmissible. And you can't tell. Somebody can be shedding it. Let's see, I think I read somewhere where the first 2 days before you're symptomatic, you're highly contagious at that point.
right,
And then after you are symptomatic, like the first thing I did was I had mild symptoms, but it was a sore throat and a little bit of chest congestion, and the symptoms were over in 4 days. The first couple of nights I took NyQuil, and I didn't need to take anything during the day because it was mild. But I was pretty germy. But you couldn't tell it because I was masking it with the NyQuil.
Mhm.
Yeah.
very good
Also,
point.
also, I never had a temperature. My blood oxygen level was 97 the whole time. My temperature was 97.1. So as you, I had started with the sore throat and I had coughing, and then I did like you. I took Mucinex, which killed the coughing pretty good, and like you, NyQuil at night helped me sleep.
I
But
didn't have a fever, and my oxygen levels were good.
yeah,
Yeah, the other thing too is that those things that you're speaking of, some of them are not observable, but it still doesn't stop you from being uh, observant of things that you might be able to detect.
Well, I
Well,
feel
Yeah, sometimes you can be observant. I have a friend who has two sons, one in Chicago, one in Boston, and they came in on Thursday and they went all three to be tested. They were negative. Friday morning, she got a notice that she was in contact with someone who had COVID. Oh, that's nothing to it. Within hours, she had a sore throat.
I,
And then her husband got it, very sick. Christmas morning, 9 o'clock, the son was on a plane going back to Chicago, and the other son was going back to Boston. And she felt horrible. She said, I'm the Grinch that stole Christmas. It wasn't her fault. Other people out there, carriers, some I think even know it, and they're just so careless. They don't cover up, they don't protect themselves. So,
40,
what can you do?
40% of the people who are asymptomatic uh, shed the virus. So, as Daryl had said, that's one of the problems is that, as he said 2 days before, you are positive you're shedding. So,
Mm.
uh, the best thing is to be masked up as much as possible and be boosted because that's the best protection.
Yeah, my quarantine is up tonight, and so tomorrow I'm free to roam the world. Providing I'm looking for a testing site to get a test to make sure I'm negative. But as careful as I was, now that I'm double vaccinated and boosted and have had the Omicron variant, I feel pretty bulletproof. I don't feel like I have to be careful anymore. I feel like I'm free. It's the wrong way to feel, but I feel that way anyway.
Well, the tests suggest that you are super immunized.
There you go. I can go anywhere, do anything. Cough in
Superman.
my face if I care.
Well, this is an interesting development that has occurred over the last 48 hours, that they've
Mhm.
cut the isolation time to 5 days. And what do you think about that? Uh,
Why?
there's been a lot of criticism about it.
Yes. Why?
Yeah,
Uh,
if you have Omicron, it's gonna spread, crazily. If you have Delta, 5 days isn't enough, I don't think. And how do you know if you have Delta or not? You know, so
Well,
Well,
the United Kingdom had Omicron before the United States, and they've done some testing over there that says that people are negative in a shorter period of time, and they've reduced the quarantine period for COVID positive in the UK to 7 days. So this is, United States is kind of lagging trends of the rest of the world that's experienced some of these variants first. So shortening it isn't terribly crazy. It's different than what we've been doing.
yeah, and I think that one of the reasons why we're behind is because we've had more coronavirus than anybody else in the world, with 800,000 plus people dying from COVID. So you can understand the delay in terms of reducing the quarantine. But as Darrell has said, this is the practice now, 5 days. But the criticism has been that this has been done for social reasons, not for biological reasons. But anyway, it's quite interesting to see how time flies, and how this turns out to be true.
I saw an interview with Fauci, and he was suggesting that when the medical professionals get COVID, he wants them back, to quicker. He doesn't want them staying out for 10 days, 7 days, 10 days, 2 weeks. He needs them back in the hospitals helping people.
Well, I think, as Darrell said, the more recent tests suggest that 5 days is good enough. He's also talking about people who have already been vaccinated,
Right.
which makes it different also. Right.
The other thing, knowing the United States, it might also be financial reasons.
Oh, they are. As a matter of fact, many people thought that that was a major impetus. But, well, time will tell, because we'll see how it works out. I'm sure all of the above are valid. Now, this is a good question. How do you protect a child who's too young for the vaccine? And that's an easy answer, but what it means is that you have to be as careful as Darrell used to be before he became super immunized. And wearing masks, social distancing becomes very, very critical. And so limiting gatherings, especially indoor gatherings, becomes absolutely critical.
Dr. Kellner, it's going to be funny to try to get a young child to keep a mask on.
That's why that's that's almost an impossible task. So
Yep.
yeah, so that's why all the other issues need to be addressed. So many bowls have been canceled and games have been postponed. It's been remarkable to see how, when we think we're getting to the end of the pandemic, that so many people are turning positive, that all athletic endeavors are being hampered by it. Now, it's interesting that here on a warship crew, that 25% of the people on it tested positive. And those who are thinking about going on cruise ships, they are probably rethinking it. But cruise ships are still taking passengers. They still have trips set up for January.
You know, on a cruise ship, it seems like being quarantined is going to be really taxing on people. They have to stay in their little cabin all the time. Can't go anywhere.
Yeah,
Mm.
yeah, it is. Yeah,
How do you quarantine on a ship?
that's tough. That's tough. Wow. Now, this is a question that I've often thought about. When we say people are fully vaccinated, uh, should we include the booster in that definition? Uh,
Mhm.
what are your thoughts about it?
Definitely.
Yes.
Yeah, I
Yes.
agree. You should.
Yeah.
Yes.
Mhm.
Yeah, I think you can't call yourself fully vaccinated if you haven't had a booster shot.
Right.
And probably a new booster every 90 days.
Well, and that the question is whether the people who fall into John Buchanan and Daryl's category, uh, most people think uh, you may be suitable for at least 90 to 120 days, at least 6 months, maybe. But we don't have enough tests to find out because there's not that many people who have been super immunized like you guys. So they need to test you and find out whether that fourth shot becomes necessary, or whether after that immunizing infection, uh, you are immune for a longer period of time or not. This is interesting, the different perspectives, pretty much agreeing that without the booster shot, you're not fully protected. And remembering that the goal of the booster is to not only to protect you from getting the virus, but to keep you from needing to go to the hospital or dying. That's the real focus of boosters.
Mhm.
Well, it's gonna be interesting to see how all this, just as Janice said, a lot of people are very confused about it all.
Mhm.
And how do you keep them from, how do you bring clarity to the issue? The reason there's a lack of clarity is because this is new to us and we're learning as we go. And that makes it difficult for us. Because we're used to being in control and knowing what's going to happen next. But in this situation, we don't. And this is a pill that has been authorized to treat the virus. Now, by the way, it's suggested that those people who get the virus who are unvaccinated, they don't respond within 2 to 3 days. They are recommended to have an infusion of the monoclonal antibody therapy. Because since they're not vaccinated, there's an increased incidence of hospitalization and death. So if you have somebody who's unvaccinated, after 3 days they're not improving, it's wise to for them to take the monoclonal antibody therapy. That's the recommendation.
So, Dr. Callender, you're saying that this pill won't work for them, or if it
No,
doesn't?
I'm not saying that because we don't know. This has been tested against this variant. I'm saying that if you're unvaccinated and you get COVID, and you're not improving after 3 days, a way to prevent hospitalization and death is to have the infusion, right? And I don't know that this has been tested against the Omicron variant.
Okay.
So anyway, that's the recommendation. As was recommended, when this came out, this was originally thought to be given to the people to prevent them from requiring hospitalization. Although we already know that infusions of monoclonal antibodies have been preventive as well. So, whether this can replace the infusion is the data shows that 90% of hospitalizations or deaths were prevented when its pills were taken. Coronavirus. I don't know if these pills have been tested for the Omicron variant, though. That's the only difference about the pill. And you might ask, well, what about the infusion? Same thing is true for the infusion. We know that it works for the Delta and the other, but we don't know exactly the situation for the Omicron yet. And this is suggestive that it may be effective. That's different, but the best way to know is to take the medication and see what happens. What should you do if you have asymptomatic COVID-19, which is something 40% of the COVID cases were asymptomatic. So many people have it and are spreading it without knowing it. And that's why what Biden is doing by sending out the rapid tests is so that those people who are asymptomatic can get tested, find out whether they're positive or not.
Yeah.
So they can take steps to keep their positivity controlled.
Since I tested positive, the Illinois Department of Health contacted me the next day and took a survey, and they did contact tracing. Got the phones and names and phone numbers of anybody I've been in contact with the last couple of days, and so they probably, they contacted them and asked them to get COVID tests, and they may have been asymptomatic COVID people, but they recommended that they quarantine shorter period of time, but they treated them as potential asymptomatic COVID.
Sound like good advice. Were you performing before you turned positive?
Yes.
So you don't know if you got it in any of your performances, perhaps?
Yeah, I probably did. And so, I gave the health department names and phone numbers of many people I knew that they were around my performances. And they kept it confidential. They didn't say that you may have caught COVID from Daryl Armistead.
They didn't say Darryl gave you COVID.
Right, they just said you've been exposed to COVID.
Yeah.
Yeah, I was not. I was not
a whole lot of gigs if they knew who did it.
Yeah, my performance Saturday the 18th at about 500 people. It was a dance and a banquet, and everybody was required to have masks except while they were sitting at the table eating.
Well, that's
So that was it.
yeah.
And out of the 11 members of my band, 4 of us came up positive so far. The band leader, me and the drummer and the manager all came up positive.
Well, this talks about the rapid test and the PCR test. Of course, the PCR is thought to be the gold standard, so to speak, because there are false positives with the rapid test, but most people feel that it's worth the false positivity because you can always get the PCR test and find out if you really have it or not. And so go back to this because I think this is what you do. It's the best advice, whether you develop symptoms or not. Stay home and isolate yourself. And you know, the richer you are, the easier it is to isolate yourself. Some people don't have the luxury of having 2, 3, and 4 bathrooms. And so it becomes less easy when you don't have, when you share everything, like in the old days, many used to do. And of course, this uses the old system of 10 days, which is now 5 days. But
one thing I learned from the quarantine is that I could have my groceries delivered, which was pretty cool. They just delivered them to the front step, no human contact.
yeah. Well, this is an article that talks about the cloth mask. Well, it talks about how you need they call it a real mask. But because of the contagious nature of Omicron, they feel that cloth masks not as useful.
Yesterday on TV, they were doing a test of masks, and you can put your mask on, light a candle. If you can blow it out, the mask is no good. And so it said that the cloth masks were not safe, but the blue medical ones were. But I guess any mask, you can go through that testing process. I haven't done it yet, but I'm gonna try it today. If you blow that candle out, then you don't have a good mask.
Right.
Well,
And
Janice, you better be careful because if that cloth mask catch on fire, you're in trouble.
I won't be that close.
well, the layered masks can be effective, but the cloth masks apparently are not. So, and they even talk about if you have a cloth mask, to wear 2 masks, which.
And with my grandkids, the blue mask, I guess it's not cool. So they need something different. They'll go for the black, they'll go for the cotton prints and stuff like that. So maybe I can convince them with this test. The blue mask is good.
well,
Dr. Callender, if you have one bathroom, does that mean that after each use, you've got to clean it down, wash it down?
Spray it.
yeah. Well, yeah, and they do have the germicides. You can do it. It just requires more attention to detail.
Mhm. And that Lysol spray becomes your friend. Every time someone comes in my house and leaves, I'll wipe down, but definitely I'll spray it, especially the bathrooms. Spray it good and shut the door.
I use this Lysol disinfecting wipes.
Mm-hmm. Mm-hmm.
Yeah, it's interesting how they say cloth masks are a little more than facial decorations. And you know, but the thing about this is when you go to these indoor public activities, most people have these cloth masks
Mhm.
and they think they're protected, but they aren't. And so when you go to a public activity that is crowded, and many of them wear these cloth masks, unless you have a 95 mask or a surgical mask, the mask, blue mask, you're not well protected. The problem with all of this information is that when you go to the public activities, they don't seem to be aware of this. Not to speak of those people who wear masks below their noses.
Mhm.
Yeah, see far too often.
Dr.
That's like
Calvin, I
not.
may be looking at too much TV or too many movies, but can these viruses be created in scientific labs?
I imagine, I don't know. Yeah, I imagine you could. I don't know if they can be created. I know they can be spread. I don't know. I don't know the answer to that question. Is it COVID or just a cold? How do you tell the difference? You guys have found out how to tell the difference. You get a COVID test.
Well, I tell you, when I had this COVID infection, it felt different. It didn't feel like a cold.
Mm. And here they detail the common cold symptoms, which is the same symptoms that you have with the cold. And the
Did
same
anybody
thing you
have
have.
uh, poor taste in food? Did the food taste different?
I didn't
Well,
lose taste or smell.
I did
neither
not
did
either.
Buchanan.
I did not lose taste or smell. No fever.
Yeah. Whenever I get a cold, I get more of a runny nose, and I didn't have a runny nose at all with this.
I had a runny nose.
Well, apparently John Buchanan had the Maryland version.
Uh,
No, DC version.
This is Sylvia Charles, my husband. He only had, I think he did not have a sore throat. He did not have a runny nose, but he had congestion. And he did not lose his taste for food.
That's an interesting observation. I wonder if it's also true of the those who are not vaccinated.
Now, my daughter, this is Dolores. My daughter had congestion, runny nose, no fever, and she, after a couple of days, she did lose her sense of taste.
Well, did she turn positive?
Yes, she was positive.
Okay.
She just finished her quarantine on Monday.
Oh, well, now has she been vaccinated?
Yes, fully vaccinated.
Okay.
And she only tested positive. She got scared. They had an outbreak at work, and they say everybody had been in contact with this person. And she went and she took 3 rapid tests that were negative, and then she went and on that 5th day and took the PCR test, which came back positive, which she said she knew, but she was hoping it wasn't. But yeah, but she did fine. We quarantined. I gave her the upstairs part of the house. I took the downstairs.
Okay. So it's nice when you got an upstairs and a downstairs.
That's true. And for Christmas, we ended up Zooming Christmas because with my mother being 92 and just had surgery, nobody wanted to go near her.
Good. 92, huh? Wow.
Yes, sir.
I wonder
Well,
how vegan food tastes when you lost your sense of taste.
It tastes the same, John. I mean, when you lost your, okay, I didn't lose my sense of taste, and vegan food tasted the same to me.
There are you, though, be the only one that could answer that one.
Okay. Let's go to the next one. I like that question. Is it too late to get vaccinated? And
Dr. Callender, I'm glad to see that because I have a couple of friends who still are not even vaccinated. And, it concerns me, but for whatever reasons of their own, they still will not get vaccinated. So it's not too late, hopefully, and prayerfully they don't catch anything.
yeah.
But I will let them know again that it's not too late.
Yeah. Wow. Well, the thing that is amazing is that in different parts of the country, people prepare for the virus differently. Some parts of the country, they don't do anything. They don't wear masks. They don't social distance, do anything. Other places, they wear masks. Like New York, of course, they wear masks.
I was
But
watching some of the football games, Doc, and some people had masks, a bunch of them didn't. And they were sitting right
Yeah.
next to each other. They were
Yeah.
outside though, outdoors, but still.
Well, inside is not much difference, unfortunately. Although it is now required in the NBA to wear a mask if you're not playing. You have to wear a mask. And the coaches have to wear masks. It's amazing the impact it's had on the flight cancellations.
It's because a lot of the workers
Yeah,
are sick.
yeah.
I was scheduled to take. I had a United flight from Chicago to Baltimore over Christmas, but all the United flights were canceled.
All of them. Wow. Hmm. Can you imagine 100,000 infections in one day? Wow. Yeah, but what's amazing is the impact on the restaurants. So many restaurants have closed because of the pandemic, and other businesses have closed. The economic problems associated with the pandemic are just beyond belief. Now we're finally addressing the mental health issues that, as somebody mentioned last week, we didn't do very much in preparation for the mental health crisis that we knew was coming. And I think we're yet to do mental health crisis intervention to the extent that we need. It's probably going to require more mental health crises like suicides or mass murders to get us to do the right thing. Now, this is interesting because what your daughter experienced may be ramification of this fact that the rapid test may be less sensitive than the well, we know it's less than the PCR anyway, but and so getting a false positive or false negative is kind of something we have to learn to deal with the rapid test.
Dr. Callender, we may have already discussed this, and if so, I'm sorry. But with people being tested positive now for COVID and it's Omicron, is Delta gone? Does it
No,
still
Delta's
exist?
still around, but it's just Right now, I think the last test said that Omicron was 59%. So Delta's still around. It's just not as prevalent as Omicron. But actually, a week ago, it was up to 79%. So it's going down.
But Delta is supposed to be worse than Omicron.
Well, Delta is, no, Omicron, well, in terms of mortality, yes. And hospitalizations, yes. Delta is more deadly and more likely to hospitalize you than Delta. If you're vaccinated, if you're unvaccinated. Because most of the recent data suggests that there are fewer hospitalizations and mortalities with Omicron than you had with Delta. So you could argue that it's a milder variant, although it's more contagious. It doesn't send you to the hospital or kill you as often as Delta did. I think if you could, the rapid test, I think it makes sense to have it and to take it if you have any question about it. However, if you have symptoms, you probably, and you're negative with the rapid test, you need to do a PCR.
Mhm.
That's the test that answers the question positively.
Dr. Callender, when you test positive, do they tell you which variant it is? Or they just tell you you test positive?
They tell you test positive.
Okay.
Now their test can tell, but I guess it doesn't matter that much. So they just
Okay.
tell you positive. Right.
You can probably tell just by the symptoms because Omicron is usually a lot milder. If you get the very serious with the fever and all that loss of taste, you probably have Delta.
Well, I have a question. Daryl and John, how did you find out what you had, or do you know?
My report did not say what I had. It said it was
Neither,
COVID.
neither did mine. It just said I was positive, and mine was positive from a rapid test.
Well, when they reporting doing all this, they don't tell the people whether they have Delta or Omicron.
No.
So how do they know? They just know you tested positive.
Right.
And what difference does it make?
Well, when they have all these statistics and everything.
Oh, they know. No, the people who do the test, they have a way of identifying Omicron versus Delta. It's just that they don't tell you what you are because you got the virus.
Yeah, I just claim Omicron because I know I always have the latest stuff.
Yeah, well, you're probably right. I mean, because that's the, that's the commonest virus floating around right now.
Dr. Callender, seems like the Omicron is not a breakthrough virus, is it?
Yes.
Yeah, of course.
Yeah.
If you're vaccinated, it's breakthrough.
Okay.
And that's
So,
when you say breakthrough, that means you've been vaccinated and you still got the virus. So that's kind of the term.
Yeah, I have bad news though. My wife just tested positive today.
That's the first time?
Yes. She had a rapid test Tuesday. When I had my negative rapid test Tuesday, she had a positive rapid test, and then she went out and got a PCR test that came back today positive.
So now she has to quarantine.
I have to take care of her for a week. She's been taking care of me for a week. Now the roles reverse.
Oh, that's nice. I mean, it's nice that you have the option to do that. Yeah.
It's only fair because you gave it to her.
More than likely.
That's not right.
More than likely.
Yeah.
Dog.
She did go out. She was going out, you know.
She'll never let you live this down.
Well, I thought that would happen before, but you know, we'll make it work.
Yeah.
Yeah, you're in the doghouse.
Well, most husbands have been in the doghouse many times. So you learn how to get out of it. Yes, dear. That's the answer. Yes, dear.
Okay, I'm listening. Be
Just stay-
careful.
Yes, dear. Yes, dear. Yes, dear.
Uh-huh.
I say yes, honey.
Yeah. Anybody have New Year's resolutions?
Yes, I gave up bread.
Okay. Wow. What are you going to replace it with?
Nothing.
Okay. Any other New Year resolution?
None. Because you break them anyway. You do it for a month or two and you're right back to the same old habits. I'm not even going to lie.
Speaking of lying, that's my resolution for the new year. Stop lying.
Okay.
Is that a lie?
I made it through last year with 17 lies. So I'm trying to lower that number down to 0. Tomorrow's New Year's Eve, right? So I get to start on Saturday. Stop lying.
You can lie today.
I have a question. The coronavirus is airborne.
Oh, that was a good question. That's good. That was my next question. We had all this stuff about surfaces before, Carol. What happens now? Is Corona and Omicron and all that still spread by surfaces?
Is it spread by surfaces or airborne? Because before, in the beginning, everybody was wearing rubber gloves.
Mhm.
Okay, we still wash our hands. Don't touch your face. We were sanitizing, or at least you all were sanitizing your groceries before you brought them in the house and left them in the garage. We don't have a garage, so thank goodness. And spraying everything down. And the spray, I guess, sanitized the air when you spray the Lysol, but from what I've heard, aerosols really, and John Buchanan, you are a scientist. They had told us for a while to stop using aerosol sprays because of our environment and the greenhouse effect or something like that. So I don't see people wearing rubber gloves as much. I don't see them wiping down the groceries or afraid to go to the grocery store and buy the vegetables. So has scientists changed or people's behaviors changed? What's going on? Because you couldn't even wear your shoes in, because we said it was airborne, but yet we're wiping down everything. So what is it?
It's airborne, but that doesn't mean you shouldn't wipe down everything.
Yeah, we learned on this group session that even though it's airborne, when it lands down on a surface, it still has life for a little while.
Right. So, so most people are still wiping down, but they recognize that it's mostly airborne.
Okay, are you hesitant about bringing your groceries in the house like you used to be?
No.
So what stopped that?
The studies that identified it as being airborne.
Okay.
Definitely, Carol. Great minds think alike. That's exactly my question that I was going to ask, because now that I'm in a reverse role, I'm wiping down the surfaces, like I said, with my aerosol, with my Lysol wipes, and just wondering how critical that is to stop the spread. That, you know, you haven't heard anything about that recently in the news. It's all aerosol.
Because it's anticipated that that is already a known fact that you ought to wipe down the surfaces.
And wash your hands. Okay.
Yes, both.
And don't touch your eyes.
Because that's another place where you get the infection in the eyes. That's correct.
So that
Any-
means we're to live in a sterile environment,
Say again?
to live in a sterilized environment.
Well, the sterilized environment is a dream. You know, we had those people who had no immunity. They had to be in a germ-free environment. But it's hard to do. So we sterilize as much as we can, but it's not germ-free.
Dr.
Yeah.
Callender, the point is that the virus thrives more in the air, but it doesn't last long on surfaces. Is that
Yes, yes, true.
You are address the red arrows.
Mm-hmm. Yeah.
You know,
Oh, it's got a lot.
I was ready to go back to work, and go back to band rehearsal, and go back to donating blood. I got a call from NIH 2 weeks ago before I got infected to donate on Monday, this coming Monday. So I called him back, and I told him I had a negative rapid test on Tuesday. And they said, well, I have to wait 3 weeks now, 3 weeks after a negative PCR test before I can donate again.
Makes sense.
Yeah.
That's sensible. Yeah,
3 weeks.
yeah, that's good.
John and Daryl, how is your energy levels? Are you drained? Are you moving slower? Are you moving at the same pace, or you feel
go for it,
tired,
Daryl.
fatigued? I'm sorry,
Energy-
say that again.
You go
Yeah,
for
my
it.
energy levels are very good. They're not diminished at all.
Mine neither.
Oh,
I feel like doing my 5 mile walk, a 6 mile walk, but I probably won't yet until I test negative.
Well, when I was symptom free on Friday, I resumed my workouts, and I do a 2 hour workout, uh, 6 days a week, and so yeah, I've had plenty of energy from that. But just taking 5 days off when I was recovering, that didn't lower my physical conditioning.
Well, the question for me, Daryl, is by laying 5 days off, was it hard to get back on schedule?
No, not at all.
Okay, Joyce, where are you? You back yet, or you still away?
I'm in Houston.
Still in Houston?
Still in
Yeah, as a
Houston.
matter of fact, someone's telling me in Houston, they don't act like they have a virus over there. They don't, nobody
It's
wears
crazy
masks or
here.
anything.
We basically been staying in. My husband has been going to the grocery store, and picking up little things that we want, but we've been basically just staying in. There's a couple of relatives that we are going to see. We saw his aunt who had her 93rd birthday and
93rd?
74th wedding anniversary, so we went over there.
Oh,
But
boy.
otherwise, we just been hanging in. It's crazy here.
Yeah,
I'm just thankful that we decided at the last minute. Well, it wasn't the last minute, but we decided to drive
Okay.
instead of
Yeah.
taking the
what's the most
flight.
what's the most dangerous location in the when you decide to fly? or decide to take the train?
What's the dangerous location? We
Yeah.
we drove.
I understand that, but I was asking to see if you know what the most dangerous part of the flying or the taking the train is.
The
Oh,
station.
no, I don't know. I would assume that it's the terminal that's
Yeah.
the most
Airports and
dangerous part.
That's
station,
right.
yeah.
Right. That's right. Walking through the station.
Yes,
Right.
Right.
yes,
Standing on line, waiting. Yeah.
yeah.
So
But
Doug,
what really,
I heard
what
the
really
so
led us to
Go ahead.
driving was the cost for the rental cars. They had just gone through the ceiling to rent a car for a couple of weeks. They wanted any up to $1,800.
Wow.
So when you tack on the additional expenses, that was just got to be a little bit too much. So we decided to drive. And I'm
How
so
long is
glad
it?
that we did.
How long is the drive?
We drove the first day for 12 hours. The second day we drove for about 7. So I guess it was about 19, 20 hours.
Mhm.
And we didn't rush. We took turns, 4 on, 4 off, and then 4 back on. So we managed, but it was a very good drive. It was the first time in Louisiana they have a bridge that's 17 miles long. That was the first time I went across that, and the first time I ever heard of the 17-mile long bridge. And it covered rivers and swamp area. That's why they had the bridge. But it was a good trip. It's a good trip. I would take it again. I would do it again.
Any of you do any flying during this the holidays?
I had flights scheduled to Boston, but we canceled those. And back, of course.
My young adult children came in, one from the state of Washington, the other one from Illinois. But they, they were vaccinated and boosted up. So they got home safe and sound.
Good, good, good.
They're back home already?
Yes.
Oh, good.
My son got held up in Minnesota. His flight was canceled, but he went to Boise, Idaho, and then rented a car to get back home.
Wow.
Mm-hmm.
What's happening with the churches? Anything changed because of Omicron? I know our church hasn't changed anything. What about yours, Carol, and other people?
I think my church is still open and going as if nothing has happened. I think the other churches that have opened up, only one that I've heard that didn't try to open up because of the Omicron. But I don't know. Others that are around here, like Sylvia and Bonnie, Rochelle, do you know what's happening with your churches?
I don't know what's happening with mine, but I did see where the first, First Baptist Church of Glen Arden, where they have normally TD Jakes, they have canceled their in-person service for the New Year's, and they're going virtual.
Yeah, ours is virtual too.
We're still virtual too.
We're still virtual.
My church is half and
Springfield
half.
does both, but they're virtual for the New Year's celebration.
Yeah, mine is half and half.
Oh, is that right? Yeah,
Hybrid. Yeah.
that's gonna be different because I'm so used to going to that midnight service, but just have to do it virtually because that's the way it is these days.
Yep.
Okay, well, everybody have a happy new year, and Pearline, you still on the line? Yeah, give me a call later. I still haven't heard from Dr. Melanson.